Have you ever thought low blood pressure is always a good thing? Most of us worry about high blood pressure, but few realize that when blood pressure drops too low, it can be just as dangerous, and sometimes even fatal. From dizziness and fainting to organ failure and shock, low blood pressure can silently threaten your health in ways you may not expect. In this video, we'll break down exactly how low blood pressure becomes dangerous, what happens inside your body when circulation fails, and why it's so important to recognize the warning signs before it's too late. Inadequate blood flow to the brain. The brain is one of the most vital and sensitive organs in the human body, depending on a continuous supply of oxygen and nutrients delivered through blood circulation. Unlike muscles or other tissues, the brain has no reserve of oxygen or glucose, meaning even a short interruption in blood flow can have immediate and serious consequences. When blood pressure drops too low, or when blood vessels are blocked or narrowed, the brain may not receive adequate blood flow, a condition known as cerebral hypoperfusion. This lack of circulation can impair brain function within seconds and, if prolonged, can result in permanent damage. One of the earliest effects of inadequate blood flow to the brain is dizziness and lightheadedness. Many people experience this sensation when they stand up too quickly, a condition called orthostatic hypotension, in which blood temporarily pools in the lower body before the circulatory system can adjust. While usually short-lived, frequent episodes can increase the risk of falls and injuries, especially in older adults. If blood flow is further reduced, fainting syncope may occur, which is the brain's way of shutting down to protect itself from prolonged oxygen deprivation. In more severe cases, inadequate brain circulation can cause confusion, difficulty concentrating, blurred vision, or slurred speech. These symptoms mimic those of a stroke and should always be taken seriously. If left untreated, the condition can progress to seizures, loss of consciousness, or coma. Long-term or repeated episodes of poor blood flow increase the risk of cognitive decline, memory problems, and even dementia, as brain cells cannot survive without consistent oxygen and nutrient supply. The causes of cerebral hyperperfusion are varied. Critically low blood pressure from dehydration, blood loss, heart failure, or severe infection can all reduce circulation to the brain. Blocked or narrowed arteries from atherosclerosis can also restrict flow, while irregular heart rhythms may prevent the brain from receiving a steady supply of blood. In all cases, the underlying issue must be identified and treated quickly to restore proper circulation and prevent lasting injury. Ultimately, inadequate blood flow to the brain is a medical emergency when symptoms are sudden or severe. The brain is extremely vulnerable to oxygen deprivation, and even a few minutes without proper circulation can lead to irreversible damage. Recognizing the warning signs such as dizziness, fainting, sudden confusion, or vision changes is critical. Prompt medical care, combined with managing risk factors like dehydration, heart disease, and blood pressure abnormalities, can help protect brain health and prevent the dangerous consequences of reduced blood flow. Reduced oxygen to the heart. The heart is the engine of the human body, tirelessly pumping blood to deliver oxygen and nutrients to every organ. Yet, like all muscles, the heart itself requires a constant supply of oxygen-rich blood to function properly. This supply comes from the coronary arteries, which branch off the aorta and feed the heart muscle. When the amount of oxygen delivered to the heart falls short of its needs, a condition known as myocardial ischemia occurs. Reduced oxygen to the heart is a dangerous state that can lead to chest pain, heart rhythm disturbances, and in severe cases, a heart attack or sudden cardiac death. One of the first consequences of oxygen deprivation in the heart is chest discomfort, often described as pressure, heaviness, or tightness. This symptom, known as angina, is a warning sign that the heart muscle is struggling under reduced blood flow. Angina typically occurs during exertion or stress, when the heart's demand for oxygen increases. If blood supply cannot rise to meet this demand, pain develops as the heart muscle is starved of energy. Rest or medication may temporarily relieve symptoms, but the underlying oxygen shortage remains a serious risk as oxygen deprivation worsens. The heart's electrical system can become unstable, leading to arrhythmia or irregular heartbeats that may cause palpitations, dizziness, or fainting. Some arrhythmias are mild, but others can disrupt the heart's ability to pump blood effectively, resulting in cardiac arrest. When oxygen supply is severely cut off for even a short period, heart muscle cells begin to die, causing a myocardial infarction, commonly known as a heart attack. The longer the heart remains deprived of oxygen, the more tissue is lost, permanently, weakening the heart's ability to pump. Several factors can reduce oxygen delivery to the heart. Blockages in the coronary arteries from atherosclerosis plaque buildup are the most common cause. Blood clots, severe anemia, extremely low blood pressure, or respiratory conditions that reduce oxygen in the blood can also limit supply. In some cases, intense physical exertion or emotional stress may trigger sudden oxygen shortages, especially if underlying heart disease is present. Reduced oxygen to the heart is a medical emergency when it leads to prolonged chest pain, shortness of breath, or fainting. Prompt treatment is essential to restore blood flow, prevent permanent damage, and save life. Lifestyle changes such as quitting smoking, eating a heart-healthy diet, exercising regularly, and managing conditions like diabetes and high blood pressure can reduce the risk of oxygen deprivation. For those already diagnosed with heart disease, medications and procedures such as stents or bypass surgery may be necessary to improve circulation. Organ failure. Every organ in the human body depends on an uninterrupted flow of oxygen-rich blood to function properly. The heart pumps blood through the circulatory system, delivering oxygen and nutrients while also removing waste products. When blood pressure drops too low for too long, this vital circulation is compromised. Without sufficient perfusion, tissues and organs cannot sustain their normal functions. Over time, or sometimes within minutes, this lack of oxygen and nutrient delivery leads to organ failure. One of the most dangerous consequences of severely low blood pressure. The kidneys are among the first organs to suffer when circulation weakens. Their role is to filter waste and excess fluids from the blood, a process that requires steady pressure to push blood through the filtering units known as nephrons. When pressure falls, the kidneys cannot function properly, causing waste products and toxins to build up in the bloodstream. If not corrected, this results in acute kidney injury, which can quickly progress to kidney failure. In severe cases, dialysis or kidney replacement therapy becomes necessary for survival. The liver, another critical organ, is equally vulnerable. As the body's detoxification center, the liver processes toxins, metabolizes nutrients, and produces essential proteins. Reduced blood flow deprives liver cells of oxygen, leading to tissue damage and impaired function. A failing liver cannot remove toxins efficiently, regulate blood clotting, or maintain proper metabolism. This condition, often referred to as ischemic hepatitis or shock liver, can develop rapidly in the setting of low blood pressure and may become life-threatening if circulation is not restored. The gastrointestinal GI tract also depends on continuous blood supply. In states of hypotension, blood flow to the gut may be reduced as the body prioritizes circulation to the heart and brain. This can cause tissue damage in the intestines, leading to ulcers, bleeding, or a condition called ischemic bowel disease, which can be fatal if left untreated. When multiple organs are deprived of blood flow simultaneously, the result is multi-organ failure, a critical condition that is often seen in severe shock. In this state, the kidneys, liver, lungs, and brain all begin shutting down. Once several organs fail at the same time, the chances of survival drop dramatically, even with aggressive medical treatment. Ultimately, organ failure due to low blood pressure highlights the importance of maintaining stable circulation, whether caused by severe bleeding, infection, heart failure, or dehydration. Dangerously low blood pressure sets off a chain reaction in which vital organs cannot sustain themselves. Recognizing early warning signs such as confusion, decreased urine output, chest discomfort, or shortness of breath is crucial. Immediate medical care to restore blood flow can mean the difference between recovery and irreversible organ damage. Shock circulatory collapse. Shock, also known as circulatory collapse, is one of the most severe consequences of extremely low blood pressure. It occurs when the circulatory system fails to deliver enough blood to the body's tissues and organs. Without adequate circulation, cells are deprived of oxygen and nutrients, leading to rapid deterioration of organ function. Shock is not just a symptom but a life-threatening emergency, and if left untreated, it almost always results in death. At the core of shock is a mismatch between the body's needs and the supply of oxygen-rich blood. When blood pressure falls too low, the body attempts to compensate by increasing heart rate, constricting blood vessels and diverting blood to vital organs like the brain and heart. However, if the underlying cause is not corrected, these compensatory mechanisms quickly become overwhelmed. As a result, oxygen delivery to organs drops further, and waste products such as lactic acid begin to build up in the blood, creating a vicious cycle that accelerates organ damage. There are several types of shock, each with different causes but similar outcomes. Hypovolemic shock develops when severe blood or fluid loss such as from trauma, dehydration, or internal bleeding drastically reduces circulating volume. Cardiogenic shock occurs when the heart itself fails to pump effectively, often following a major heart attack or advanced heart disease. Septic shock arises from a severe infection that spreads into the bloodstream, causing widespread inflammation, vessel leakage, and dangerously low blood pressure. Anaphylactic shock, triggered by a severe allergic reaction, causes blood vessels to dilate and fluid to leak out, collapsing circulation within minutes, despite their different origins. All types of shock result in dangerously impaired blood flow. The symptoms of shock reflect the body's desperate attempt to preserve life. Early signs may include rapid breathing, a weak but fast pulse, clammy or pale skin, dizziness, and confusion. As shock progresses, blood pressure drops further, urine output decreases, and mental status worsens, sometimes leading to unconsciousness. Eventually, if not reversed, shock causes multi-organ failure, in which the kidneys, liver, lungs, and brain shut down. Once multiple organs fail, the likelihood of survival is extremely low. Treatment for shock requires immediate medical intervention. Restoring circulation is the highest priority, which may involve intravenous fluids, medications to raise blood pressure, oxygen therapy, or even advanced life support measures. In many cases, the underlying cause such as stopping bleeding, treating infection, reversing an allergic reaction, or supporting heart function must also be addressed urgently. The faster shock is recognized and treated, the greater the chance of survival and recovery. No reserve for sudden demands. The human body is designed to adapt to sudden changes and stresses, such as standing up quickly, fighting an infection, or responding to blood loss. Normally, the cardiovascular system maintains enough reserve capacity to handle these shifts. This reserve allows the body to increase heart rate, constrict blood vessels, or boost cardiac output whenever extra circulation is needed. However, when blood pressure is already too low, the body lacks this protective buffer. The inability to meet sudden demands becomes a dangerous limitation, one that can quickly lead to collapse or organ failure. One example of this occurs in people with orthostatic hypotension, where blood pressure drops sharply when they stand up. In healthy individuals, the body compensates by tightening blood vessels and increasing heart rate to keep blood flowing to the brain. But in those with low baseline blood pressure, these mechanisms may not be strong enough, causing dizziness or fainting. Even minor stressors like standing, eating a large meal, or becoming slightly dehydrated can overwhelm their limited reserve, increasing the risk of falls or injuries. Another critical situation is during illness or injury. When the body faces infection, blood loss, or dehydration, it needs to boost circulation to vital organs and immune defenses. If blood pressure is already low, the heart and vessels cannot rise to the occasion. For instance, in severe infections, the immune system releases chemicals that widen blood vessels, dropping blood pressure further. A healthy cardiovascular system might adjust, but a compromised one collapses into septic shock, where organs quickly lose function. Similarly, people with heart disease or weakened cardiac function are at greater risk. The heart may already be struggling to pump blood at rest, leaving little reserve capacity to handle exertion, stress, or even emotional strain. A sudden demand such as climbing stairs or experiencing acute anxiety can tip the balance, reducing oxygen delivery to the brain or heart itself. This explains why individuals with chronic low blood pressure or underlying cardiovascular disease may experience fainting spells, chest discomfort, or sudden cardiac events during physical or emotional stress. Ultimately, lacking reserve for sudden demands is what makes low blood pressure especially dangerous. While a person may appear stable at rest, even small challenges can push their body beyond its limits. Without the ability to adjust, circulation falters, oxygen supply dwindles, and vital organs begin to fail. Recognizing this hidden risk is important, as it highlights the need for managing low blood pressure proactively through proper hydration, gradual changes in posture, treatment of underlying conditions, and close medical monitoring. By strengthening the body's capacity to handle sudden demands, the most dangerous consequences of hypotension can be avoided. And there you have it. While low blood pressure might seem harmless, it can quickly become life-threatening when it starves the brain, heart, and other organs of oxygen. From dizziness and fainting to organ failure and shock, the consequences can be severe if left untreated. Remember, not all low readings are dangerous, but sudden drops or ongoing symptoms should never be ignored. Stay hydrated, monitor your blood pressure regularly, and seek medical advice if you experience warning signs. Your health is in your hands. Understanding the risks is the first step toward protecting yourself and your loved ones. If you found this video helpful, don't forget to like, share, and subscribe for more health insights. Stay informed, stay safe, and take care of your heart and body.